Good evening. You can do better than that. That's better. I like the sound. This is a celebratory event. I'm Ken White, I think you all know by now, but President of the American Academy of Nursing. On behalf of the Board of Directors, it is our pleasure to extend a very warm welcome to you for our annual Academy Awards and Living Legends ceremony. Yes, Academy Awards. Honoring individuals who have made extraordinary contributions to health and healthcare is a privilege. The value they have added to the lives of countless individuals around the world through their research, practice, policy, and big impact truly is priceless and worthy of honor. They have made sacrifices, shared in their successes, and shaped a brighter future for all of us. It is an exceedingly difficult task as a board to select individuals for these high honors because nurses on every continent need more praise for what they have done to advance innovation and progress in the name of public health. Tonight, we begin by honoring the Academy's 2022 award winners. The ability to recognize these incredible individuals in such a special way would not be possible without the generous support of our sponsors. Deep appreciation is extended to Cedars-Sinai for their investment and the impact of their generosity on showing the larger, yes, thank you, on showing the larger community that nursing knowledge is key to reforming healthcare systems. Tonight's first award is the Academy's Civitas Award. This is given to an individual who has embodied extraordinary dedication to excellence in promoting quality care. This year, that distinction goes to Dr. Peter Buurhaus. Professor of Nursing and Director of the Center for Interdisciplinary Health Workforce Studies at the Montana State University College of Nursing. A prolific writer and healthcare economist, Dr. Buurhaus is well known for his research on the nursing workforce in the United States. His research includes employment, education, and demographic trends in the nursing profession, forecasting workforce supply, and assessing the quantity, quality, and cost of care. With over 170 publications, his findings have had a direct impact on education, labor, and economic policy at the national level. He is sought after by federal agencies for his projections and was appointed chair of the National Healthcare Workforce Commission that was created under the Affordable Care Act to advise Congress and the administration on health workforce policy. The Agency for Healthcare Research and Quality has deemed some of his work as classics, and they indeed are within our field. He is a true leader from within and for us in our profession. Dr. Buurhaus's most recent undertaking has been his research for the National Academy of Medicine's Committee on the 2020 to 2030 Future of Nursing Report, and a member of that committee. Dr. Buurhaus' body of work has helped to transform the profession and bring attention to the benefits of nursing care to the forefront across policy, education, and implementation. He actively promotes the impact nurses have had on the healthcare system and is a strong force working to ensure that the next generation grows to the level needed to support communities across the country. Dr. Buurhaus is a change maker, voice for the profession, and an advocate for providing quality care. On a personal note, when I was a nursing student being inducted in the VCU chapter of Sigma Theta Tau in Richmond, Virginia, I was given the task of retrieving Dr. Buurhaus from the Richmond airport. It was a long time ago, but I never forgot our conversation. And at that time, there were not many men in nursing, and he is one that I aspired to be like. I have been a fan ever since. And I have consulted with Peter a few times when making major career decisions. Peter, you've made a difference, and your legacy continues to matter in our profession. You are incredibly deserving of this year's Civitas Award, which I present to you for your visionary leadership, as well as your unwavering commitment to the profession. Peter.
Wow. I wasn't expecting that. But I want to say thank you to the Academy. But thank you, Ken. You've been a source of inspiration for me, and that was really, I'm touched, and I thank you. I also have other thank yous to make, and to my family and to my wife, Anna. Without them, I wouldn't be here. A very deep thank you to my research teammates, and I have a lot, but that 4 or 5 people that were most impactful in my life, helping me have impact through my research. Doug Stager, David Arbach, Jack Needleman, and Karen Donnellan. Without them, I wouldn't be standing here. There's universities that I've been at that have, in one way or another, educated me or given me opportunities, and I just want to acknowledge the University of Michigan, University of Iowa, Vanderbilt University, Harvard, Johns Hopkins, and Montana State University. Thank you. And then the funders, many funders that have kept us going and helping us figure out answers to important questions. But the one funder that has probably been closest to me and the most supportive throughout my career is the Robert Wood Johnson Foundation. So I want to say thank you to them. And I would just say that, every day we make thousands of decisions, tiny ones, big ones. They're always going on. You're conscious of them. You're unconscious of them. And I think of the number of those decisions are probably as large as the number of stars in the universe. But the best decision of all of those I made was to become a nurse. I'm not the only one who can say that. I think this whole room is full of people who can say that. And because once you did that, everything else was hard work, relationships, a faith in yourself, and here we are this evening. So I want to say thank you to all of you for what you're doing to advance our profession, and thank you again, Ken and the Academy and Linda.
Thank you, Peter. I now have the privilege of recognizing the recipient of the Academy's Healthcare Leader Award. Created in 2008, this award recognizes an influential national leader dedicated to improving the health of the nation through contributions to organizational excellence. This year's award goes to Jenny Chin Hansen. Immediate past president of the American Geriatrics Society, the largest professional organization of gero clinicians committed to the care of older adults living with care complexity. She is extremely deserving of this award, And as a palliative care nurse practitioner, I am well aware of Jenny's contribution, and I highly commend her for leadership in this patient population. Ms. Hansen is a dedicated advocate for the care of older adults, having advocated for the establishment of geriatric emergency departments in San Francisco. Before her position at the American Geriatric Society, Ms. Hansen served as president of the AARP, which represents over, get this, 38 million members. That's big. During her term as president, she led the organization through the negotiations and development of the Affordable Care Act that included groundbreaking provisions for older adults. Her advocacy for and support of the aging community has been a cornerstone of her career, and for 25 years, Ms. Hansen has championed the integration of medical and community-based services for nursing home eligible individuals in San Francisco. A true innovator, Ms. Hansen's groundbreaking coordinated service delivery system became the prototype for the 1997 federal law, which established the Program of All-Inclusive Care for the Elderly, or PACE, into the Medicaid and Medicare programs. We all know PACE. PACE now operates extensively in California as well as 30 additional states. In addition to her unrelenting commitment to the care of older adults, Ms. Hansen is also a formidable policy leader, not just due to her involvement with the ACA, but through her dedicated service on the Medicare Payment Advisory Council. She has represented the nursing profession on some of the most critical federal policies. Ms. Hansen is also extremely active in her state of California, where she serves on the Governor's Commission on Healthy California. This month, she appeared in a consolidated one-hour special with the other 11 Sages in Aging with the national PBS networks. Jenny, your accomplishments on behalf of older adults, an oft overlooked segment of our population, is truly commendable. It is a pleasure to have you accept this award. Jenny.
Well, thank you. That was a wonderful Mutt and Jeff view here. No? It's interesting. My husband's 6'2", and I don't feel short. I look at him and I think, I know, somehow a short person who ended up feeling tall. So, well, I was so delighted. Some of you saw the opening session yesterday, and the theme of stepping out as well as bringing all in, I think runs through my DNA, and I'm so blessed to do that. What I've had a chance to do for my 25 years at OnLock, the original PACE program, was not possible, as others will say, with the types of public achievements that we get recognized for, is that hundreds of people had a chance to make this possible. And what's most interesting that I think many of you don't know is that this program that became a Medicare benefit was started originally by a social worker and a dentist. This is a non-medical model from the very get-go, and yet it incorporates medical care, of course, as many of you know. And so it rose from the community, and this whole notion of planning from the where people come from and where they are. Some of you are familiar with co-design as a principle at this stage. And that was not even a formal term at that particular point, but it was really based in the community. As a quick nutshell, it was a time that community planning brought everybody together, and they looked at the data from the demographics and some of the available and non-available services. And what this community did in Northeast San Francisco, it divvied itself up. Somebody took childcare, somebody took mental health, somebody took well seniors. Unlock took the elders who were more frail. And all together, we partnered to divvy up the work in order to meet the community need. But the assessment was actually done by the community. So fast forward, I want to acknowledge that once again, Robert Wood Johnson Foundation was absolutely pivotal. So Robert Wood Johnson Foundation. You are the river that runs through a lot of healthcare reform, and healthcare delivery. So we thank you for that really important funding for us to replicate. And I'm happy to say we have another state that has joined in to have PACE. We now have Missouri included. So that's a delightful, I think, movement toward giving options to older people with chronicity a chance to live in the community. You know, I had a chance to attend some of the sessions, as many of you had, and I was very moved by Peter's session along with Dr. Linda Aiken. And I was delightfully surprised that there are 186,000 new nurses who are joining us every year. So we have Peter's really important work on workforce, but one of the things I really would like to raise, and the fact that we've been able to replicate the PACE program, is how important it is to take care of all members of our team that do the care. And so as we bring in new nurses, and as we are asking ourselves and for them to eventually step up, we want to bring them all in. So let us continue to make sure that not only do we give them knowledge, not only do we give them hopefully good rotations and where they do their learning, but let's take a breath in terms of bringing them all in to hear and learn a bit about where they come from. I think the yesterday morning session about people who offer something a little bit different, don't present in the typical profile, but have done tremendous work in serving their communities and forging leadership that will be larger. So I think we all know that it's not a zero-sum game, that we elbow and do that. There's so much need in our society, both here and internationally, that we have to open up both our hearts and our heads and embrace people whose backgrounds are different from ours in terms of our core abilities. I think when we do that, we'll realize a force multiplier in terms of our ability to serve the country and internationally. So I thank you so much for this incredible recognition. Ken, I know this was part of your role, but I just want to say that when I have a chance to get an award, and a big award like this, I use it really as a point of obligation that I am charged with doing something with this. So this is not an endpoint. Being a member of the Academy is not an endpoint. If anything, it's a call to serve. And I hope I can continue to do that along with the Academy and all the other touch points that I happen to have. We'll have a wonderful dinner, and I look forward to our legends. And again, thank you so much.
Thank you, Jenny. Our last honor this evening is the President's Award. The Academy President's Award recognizes an individual who has made extraordinary, lifelong contributions to improving the physical and mental health of individuals, families, and communities. This is the highest individual achievement award given by the Academy, and it is at the discretion of the President to be awarded when someone has been identified as truly fitting of the honor. Therefore, I am pleased to recognize Dr. Marion Broom. Dr. Broom is the Ruby F. Wilson Professor of Nursing and former Dean of Duke University's School of Nursing, with this exceptional honor for her dedication and commitment to the advancing of nursing knowledge in publication, practice, and policy. Dr. Broom is widely regarded as an expert, scholar, and leader in pediatric nursing research and practice. Her work has been funded by the American Cancer Society, the National Institutes of Health, and various foundations for over 2 decades. Her seminal research included developing and testing interventions to assist children to cope with acute and chronic pain, developing informed consent and assent practices for children in research, investigating research misconduct in clinical trials, and most recently, Dr. Broom has considered ethical dilemmas in publishing and leadership of nurse executives. She is also an influential scholar with more than 130 publications. Dr. Broom is truly a giant in our profession. In addition to this work, she has served as the president of the Society for Pediatric Nurses, as an appointed member of the Nursing Science Studies section at NIH, and she currently serves in a variety of other leadership positions. As you all know, Dr. Broom is highly regarded for her esteemed leadership of the Academy's official journal, Nursing Outlook, for nearly 2 decades. While Marion deeply wanted to be here with us this evening, she was unable to attend. I am honored to invite Marion's daughter, Dr. Elizabeth Broom Tucker, to the podium. Elizabeth, like her mother, is also a nurse.
Thank you. Good evening. It is an honor to accept this award on my mom's behalf. She is having significant health issues this fall and she's unable to attend. But she wishes to thank President White and the Academy for this incredible honor. The Academy has played such an important role in my mom's career. So many of you in the audience have also played an important contribution to her professional journey. You have been mentors, colleagues, and friends to her for over 35 years. This award could not have come at a better time for her and for our family. She is truly deserving and such an inspiration to so many of us, including myself. Thank you so much for allowing me to accept this award in her honor.
Thank you, Elizabeth. We know your mother is here with us this evening in spirit, and I hope you share with her the incredible warmth demonstrated by her peers, friends, and colleagues that surrounds the celebration of her many accomplishments. Now it is my pleasure to transition our program to the Living Legend celebration, but first, please enjoy dinner. You will notice on the screen the tributes that have been sent in from fellows and colleagues who wish to honor these incredible leaders in our profession. Enjoy your meal.